Hello and welcome to this edition of San Diego People. I'm Sandra Maas. Today's topic is what the Center for Disease Control and Prevention is now calling an epidemic. This epidemic claims hundreds of lives each year and hospitalizes many more. We're talking about heroin and opiate addiction. Last week, in less than 4 hours, one small West Virginia town underwent what the sheriff there called a mass casualty event. 27 people were hospitalized and one person died in this time span because of heroin overdoses. The medical examiner in that county says the batch of heroin in that area was probably laced with something deadly, like fentanyl. According to SAMHSA, the Substance Abuse and Mental Health Service Administration, most addicts abuse drugs to cope with mental health issues. With more on the ongoing epidemic of opiate addiction, as well as how mental health plays a role in addiction, we are joined today by Jake Hollingsworth from Coastal Psychiatric and also Dr. Sayon Thehaloli-Pahavian, the Deputy Public Health Director, Officer for San Diego County. Thank you both for being here.
Thank you for having us.
Let me start with you, and I'm calling you Dr. Sayon because it's just a heck of a lot easier for me. Give us an overview of the epidemic of heroin and opiates that has entrenched San Diego County.
Sure. So, unfortunately, as you mentioned, nationally and locally in San Diego County, we've been seeing an increase in heroin-related deaths, emergency room visits, and other, issues related to that. So we know that even just in 2014, the last year of available data, that we had 105 deaths just due to heroin. So, and many, many more for prescription opioids as well, over 260.
And why? Why has this been such an explosive problem over the last decade, really?
Yeah. And a lot of it is driven by, there's many factors that people get dependent and addicted to different substances, but we know one link that researchers have definitely made is the increase in prescription drug abuse. And so since 1999, we know that prescription drugs have been, increases in prescriptions for prescription opioids have quadrupled, and that's what the CDC is saying. So we know that people sometimes start there and then move on to different substances.
And Dr. Hollingsworth, I'm sure you have seen that in your practice. Somebody is prescribed OxyContin for some sort of pain issue. The doctor takes them off that, and then they scramble to look for that relief elsewhere.
Right, and a lot of times it's not there, and they maybe had an underlying depression or an anxiety disorder that they were using the OxyContin to kind of treat, or even the OxyContin can cause depressive symptoms. It's a central nervous system depressant, so just years of an opiate can cause depression. So now they're left with depressive symptoms that they need to find a way to treat, and if they don't do that, it's easy for them to go back to opiates because they're just so easy to get, whether it's prescription or whether it's heroin off the street.
So what happens is these pills, OxyContin, for example, can cost up to, what, $80 a pill. So instead, they go and find somebody that's selling it for a lot cheaper.
Right.
How cheap is heroin on the street?
I heard it could be as cheap as, $10 or something. So, and then especially if people who are making heroin can cut it with different things, like fentanyl or other things that they are synthetically making, they can make it cheaper. It doesn't have to be pure. And so these things can be cheaper. And as we, the medical community is trying to decrease prescription drug abuse and access to people who are likely to abuse prescription drugs, people are seeking these other alternatives.
Who is the typical, I don't want to use the word junkie, but who is the typical person that comes in and seeks help from you?
Well, when I first started at my clinic in Del Mar, I was kind of shocked by who I was seeing that was reporting that they were, had a 5-year history of IV heroin use, and it was, teenagers that go to Torrey Pines High School, and I was like amazed. But over the last year and a half, it doesn't surprise me anymore who walks in and tells me about their heroin addiction, whether it's an older male, like a white female, teenager, young adult. The demographic just doesn't matter anymore. And I think the statistics show that demographic of young adults in the suburbs is like exploding right now. It's like quadrupling like over the last several years. I think some of the things that I read recently. So it's crazy.
And I would just add that, that is, I think, one of the reasons. I think this has gone, whether it's heroin addiction or prescription drug abuse, that it's gotten to that point, kind of like diabetes, where many of us know someone else who has it or is affected. Whether it's someone in our family, ourselves, or someone else, we're all kind of touched with it because it crosses so many different types of individuals, whether it's social class or economic class or race, ethnicity. And this is one of the reasons even Congress and CDC is taking a lot of action on this topic.
And the reason why opiates are so difficult to kick is because why?
I think it's kind of a physiologic component. It just changes the receptors. So over time, you develop that dependence, and the withdrawal just makes you fiend for the drug, like just restlessness, agitation, nausea, vomiting. You just feel terrible. And when you have that amount of dependency on something, you're going to go find it. And because it's so easy to get, you just go use again, like after 3-4 hours of not using.
I read somewhere that San Diego County has the most, like in the 30s, treatments specifically for opiate heroin addiction in the state. Our county is very rich when it comes to treatment centers. Is that true?
Yes, we do have a plethora of treatment centers. I think that's available for many. The statistics I got was, I think we have 37 adult alcohol and drug treatment centers, and then we have, I think, 17 pediatric or children treatment centers.
Is that because the problem is so pervasive here in San Diego? Is that why we have so many treatment centers?
It is, yeah. A lot of, supply and demand, right, with treatment centers too. So those are just publicly funded treatment centers, and we do, we're always trying to get more people into it because we know that people need treatment if we really want to curb this epidemic.
Is enough being done to help addicts?
I think, like everything, there's always room for improvement, and there's always room to do more. So there's, I think there's a lot of work trying to be done to just decrease and reduce access to opioids and heroin and things like that, and that's work by law enforcement, by a prescription drug abuse task force that's county-wide and multidisciplinary, and then there's work by a lot of healthcare providers to really make sure that they're not over-prescribing or prescribing to the wrong individuals. And then there's, of course, there's a lot of work that needs to be done and is happening on the treatment side. There's even a new thing, since 2014, the county sheriff's department has been trained and using naloxone so that when you have someone who's in overdose and maybe at risk of dying, they can inject them right there.
And we're going to be talking about that a little bit later this morning. Dr. Hollingsworth, 2 questions for you. What percentage of the patients that you treat for opioid addiction recover and, or I guess, come clean? And how the mental illness that's involved in it, depression, is that a common link to opioid use?
Well, I don't specifically work in a treatment center, so everybody comes into my clinic looking for help with depression. And it turns out a large amount of those patients have some kind of substance abuse problem, whether it's alcohol, benzodiazepines, opiates, painkillers. So a lot of people may not be exactly forthcoming in the first few sessions, but when we start seeing some resistance or they're not getting better, a lot of times they'll kind of reveal a little bit more to me about maybe they're overusing a certain medication that they've told me, or they're using something illicit that they haven't told me.
To self-medicate.
Right, to self-medicate.
Just add, nationally, when you look at the statistics, when you look at how all the people who have a substance use disorder, about 40% of them have a co-occurring mental illness or mental disorder as well.
So that's something that we as a society have to get to the bottom.
Exactly, and I think the more we know as providers, what they're dealing with, the more we can help them.
Gentlemen, thank you so much. We were going to be talking to you again a little bit later this morning. The recovery process for heroin addicts is a hard one, both physically and mentally. When we come back, you'll meet a recovering heroin addict who was able to come out of the deadly spiral of active drug abuse. Welcome back to San Diego People. Our topic today is heroin addiction and how it's increasingly becoming a major problem across the country. Although there are many ways for people addicted to heroin to get clean, the hardest part is staying clean. Out of all illicit drugs in the U.S., heroin and opiates have the highest rate of relapse, and about 2 of 10 addicts stay clean permanently, just 2 in 10. In 2013, heroin addiction was thrust into mainstream media after the deadly overdose of Academy Award winner Philip Seymour Hoffman. Hoffman had been clean and sober for more than 23 years before his relapse and death in 2013. Other celebrities like Amy Winehouse and Kurt Cobain also were heroin addicts. Cobain ended up committing suicide, which some say was because of his ongoing battle with the drug. And Winehouse died of alcohol poisoning and heroin overdose. Both of them attempted recovery numerous times and failed. And of course, most recently, Grammy Award-winning artist Prince died this year at his estate in Minnesota due to an overdose on opiates. He was expected to enter treatment just 3 days after his death. But it is the struggles of the people who are not famous, who are not in the limelight, that give many struggling addicts hope. According to the CDC, there has been a huge spike of heroin and opiate abuse among millennials, people ages 18 to 29. This has been affecting our community here in San Diego. And this morning we're joined by a very strong woman who just celebrated being clean for 4 years, recovering heroin addict Hollie Johnson. Congratulations.
Thank you.
How does it feel to be clean?
Free. Feels like freedom.
You're 26 years old. You started using at what age?
I was a little bit after my 18th birthday.
How did it all begin for you?
It started with partying in high school, you know, and then it was prescription drugs, painkillers mostly, anything that kind of made you feel good, you know, hanging out with your friends, and anything that would allow me to feel different than I felt. And then it kind of slowly progressed to heavier drugs.
When you said different than you already felt, did you have some underlying depression or anxiety or something that maybe made you turn to pills?
You know, when I was young, they had diagnosed me with depression and anxiety, but I don't know if that was necessarily a real thing for me. I just lacked coping skills, to be honest, because I don't take any medication now that I'm clean.
So those coping skills were achieved by being under the influence.
Yeah, self-medication.
So what finally led to heroin?
I think that once it finally got to Oxycontin, they kind of got expensive, and when you're buying certain stuff like that on the street, you kind of surround yourself with people who have other types of things, and eventually it just sounded like a good idea.
So you first started smoking it?
Yes, I started with smoking.
And then what?
And then IV. I used needles.
You shot up in your arm.
I
What
did.
was that like the first time, sticking a needle in your vein and shooting in a drug?
It was kind of exciting. I was kind of excited. I know that sounds really odd. You know, I watched movies like Sid and Nancy growing up, and to me I thought, ooh, that looks kind of like it would be fun, just the chaos. And I don't think that's a normal reaction from people.
And what feeling did heroin give you?
Euphoria. It made me feel free. It made me not care. It made me feel good.
And most people, when they abuse heroin, they do it with a friend, right?
Yeah, I believe so. I mean, you have to buy it from someone, and if
Right.
you don't really know what you're doing, you can't really watch it on YouTube.
But you had a boyfriend.
I did. I had a boyfriend for a long time, and we started together.
So you started using heroin together. He was a little bit older than you were.
A couple years, yeah, about 4.
And what happened to him?
Eventually, he hung himself from untreated addiction.
So he had been using for many years. And this is a picture of the two of you several years ago. And he just became depressed. And then he hung himself. What impact did that have on you?
I was devastated. I really didn't know how to deal with it. I felt lost, and I just used more drugs to try to cover up that feeling.
Where did you get the drugs from? How do you find a heroin dealer in San Diego County?
Actually, the first person that I ever did heroin with, I went to high school with. I'm not really sure how she got into it, but once you get in, you find the edge of that circle, and then you kind of just know everybody else after that, too.
And you're a lifelong San Diegan. You went to El Capitan High School?
I did.
And so the drugs are pervasive. We know drugs are pervasive on high school campuses, but how pervasive would you say heroin is?
I think that over the years, it's gotten a lot worse since I've graduated. I never knew anybody that did heroin while I was still in school. I think because heroin addicts don't make it to class, you know, it's not something you get high on heroin and go to school. But I think nowadays it's actually a lot more, because I have a younger sister, and when she went to school, it was like that there.
So what was the bottom for you? What made you decide to get help?
Actually, it was a lot of the guilt that I felt that this person that I had loved once died, And I was doing nothing with my life. I wasn't raised that way to live like that, and I have good parents, and I come from a pretty strong family, and the getting high didn't take away that guilt anymore.
Did your parents know? When did they find out?
I think the first time I told my mom, it was probably like 3 or 4 months in. I didn't live with them. We had our own place. We had a life that looked functional on the outside, you know, for a while before it all came crashing down. And my mom tried everything that she could to try to get me into treatment, and eventually she just stopped talking to me altogether.
So when everything came crashing down, describe the day that you determined that you were going to get clean?
I really wasn't actually that determined that day. I was ready to die. I didn't want to live anymore, and I did enough heroin to overdose in a bathroom in a trolley station in Santee, and somebody found me and they took me to the ER, and I had a couple shots of Narcan, which reverses the effects of
the
overdose.
Emergency drug that helps revive overdose patients.
And I was so broken because I couldn't figure out how to get clean, and I couldn't die either, and I just didn't want to live like that anymore, and they told me that I needed to go to treatment. And I went to treatment, and when I was in there, they took me to 12-step meetings.
And how helpful was that?
Oh, I mean, I still attend 12-step meetings today. I mean, it saved my life.
Did they put you on a medication as well to help make the withdrawal symptoms a lot easier?
I did take Suboxone for the first about a little over 30 days after, just so, because kicking heroin is not fun at all. It's the worst thing ever, like the flu times 100 with depression and all that stuff. So they gave me Suboxone for like the first 30 days, and before I got out, they weaned me off of it.
And you've been clean for how long?
June 3rd, I took 4 years.
4 years.
No mind-altering substances, none.
And today is the 5-year anniversary.
Yes.
Of your boyfriend's death.
Yes.
Wow. So do you think you'll stay clean?
I would hope I'd stay clean. I'm gonna keep doing the things that I need to do to stay clean.
Is it a struggle every day for you?
I don't really have the obsession to, use drugs anymore. It's really not that big of a deal, but I know that when things get chaotic in life that sometimes it sounds like a good idea, but I keep myself surrounded with other people in recovery in order to not use that as a tool.
Well, Hollie, congratulations to you.
Thank you.
You are someone to be admired, and I'm glad you're doing well. You're going to be coming back talking to us next segment as well. When we come back on San Diego People, we will be talking about ways to help stem the increase of heroin addiction, as well as how to help families suffering with a loved one who is an addict. Welcome back to San Diego People. Families and friends of addicts are usually the innocent bystanders caught in the crossfire of addiction, but there are ways to help. With more on how to prevent heroin addiction and how families can seek help, we're joined once again by Dr. Sayon, the Deputy Public Health Officer for San Diego County. Also recovering heroin addict Hollie Johnson is with us once again. Good to see you both. Dr. Sayon, let's talk about responding to the heroin epidemic in San Diego County. It's kind of a three-pronged approach. Tell us about it.
Exactly. Yeah. I mean, to really get a hold of this epidemic, we have to do several things, and we have to get ahead of it and make sure that people don't start heroin. So we have to prevent it from people even getting on board. And those are things like access, right? We're working with our provider community to not overprescribe, pain medications when not needed. Working with our law enforcement to make sure that people don't get access to it. Working with our youth and educating them so that they know, as much as they can know to make informed choices. And then we want to, of course, reduce the amount of people that are kind of getting addicted to heroin. And so these are the people who are dependent or addicted, and getting them into treatment as soon as possible. And we have a lot of treatment programs for adults and kids all around the county. We have an access line that people can call 24/7 to get information about any of these. And then last thing is that when people are right there in the overdose, at the time of the overdose, we want to try to reverse that overdose so that they don't die from the overdose. And that's things like giving, naloxone or Narcan, as some people call it. And now, like I mentioned earlier, the sheriff's department is even having naloxone on board.
And Hollie, that saved your life one time too. You had one of those emergency drug rescues.
I did. It came from a paramedic, but
right.
Yeah, I did.
Walking around college campuses, do you think that most people, could people tell when you were high, or could you conceal it pretty well? You say you were functional.
I think in the beginning nobody knew. People who knew me kind of knew, but then towards the end when I just kind of stopped caring, I think it was pretty obvious. I didn't think at the time people knew, but when I look back, it has to be pretty obvious.
Of all the different steps of treatment that you have had, what has been the most important thing that has kept you clean?
I'd have to say the 12-step meetings has been the only thing that's kept me clean.
Doctor, do you hear that often?
Yeah. I mean, different things work for different people. So we have to, I think, give everyone the menu and let them find out what works. And some people, 12-step is more important and it works, and it's whatever resonates, right? And it's not just the medical stuff to treat the actual dependence, but it's also how do you use a program like 12-step to talk about how do you live, how do you change the way that you live, and and because you're going to be exposed again to either the friends that you used to get high with, the places where you used to get high, and all these different triggers. So you want to be able to cope.
And I think people that are watching right now are probably wondering, how expensive is treatment? How do I afford such a thing? Are there free places to go in the county where you can get help? Did you pay a lot of money to get treatment?
I luckily had health insurance that paid for my treatment. I think I paid a $100 copay for 2 months of residential treatment. So
wow.
And there are publicly funded treatment centers all across the county.
And how do you find out about that?
Call our access line. Yeah, 24/7. You can call our access line.
And we'll have the access line on the KUSI website, so people that are interested can reach that. Hollie, what do you think is the most important message to get out to people about heroin addiction, and most importantly, recovering from it?
I'd have to say that it's possible to get clean. That there's help out there, and that people are really willing to help, and they don't want anything from you, just to see you succeed.
How long did it take you to get clean?
I tried to get clean twice. It was over about an 11-month process. So.
And do you ever think about heroin anymore? Do you worry that you might relapse? Is it something you struggle with every day, or is it behind you?
I think that the heroin part of it is kind of far out for me. I don't think that that's an issue as long as I stay diligent in my recovery. Now I'm more concerned about living a better life, so constantly trying to grow in that area.
And doctor, do you think that marijuana and some of the perceived lesser drugs are a gateway to heroin, or what?
They could be, depending on the drug and depending on how you're using them. I mean, I know I used to treat tobacco addiction all the time in New York City Health Department before I moved here, and there's definitely an association with a lot of these drugs and others, and especially the earlier you use some of the drugs, it can kind of rewire your brain as you're developing. And so, and we know that kids' brains develop until they're 21 to 25. So I'd say, of course, the best thing is abstinence, but we know that doesn't always happen.
We've been talking about the actual patient, the addict, but what about families? What kind of help is out there for them? You mentioned that your mom, it was just driving her crazy. I can relate to that. If my daughter or son was abusing a drug, I would be going crazy too. Where does a parent turn to try to help their child?
Yeah, I think there are several resources for parents. I think again that access line has some of those resources available, and and we need to help our caregivers and we need to help our caretakers, because it is so hard if you're a parent and you see your kid constantly struggling over and over and over against something with an addiction that is logically they shouldn't be dealing with. And so, it is very important to support each other.
And it affects the entire family. How did it impact your family, your drug abuse?
Oh, my mom said that she used to hear the doorbell ring at night, and she'd walk down the hallway and open the door, and there'd be nobody there. She would think it was going to be the cops telling her I was dead. So it was a big deal.
And how's your family unit now that you are clean?
Very happy. They're very happy to have me back as a family member.
Well, we are happy that you're on the road back, and continued success and good health to you. Hollie Johnson, thank you very much for joining us. And Dr. Sayon Thihalopiavan, did I get that right?
Close.
Close. Dr. Sayon, thank you for being here as well. We're going to have the access line on the KUSI website. And that is going to do it for this morning's edition of San Diego People. Thanks for looking our way, and join us again next week.